Smoko in the street. Trams were blocked and traffic came to a standstill as Melbourne's construction workers put their feet up in protest.
Government obviously don't want us to have our lunch sheds anymore, so if that's the case, we'll have our lunch shed here every day.
Sit in the chair, sit down.
The tradies staged the sit-in at sites across Melbourne in response to new rules that closed tea rooms, mandated vaccines and banned travel out of Metro Melbourne.
We want our sheds back for starters. We can't even sit down for lunch.
The construction industry are up in arms today because they weren't consulted. They've been treated abysmally.
I think we all need to be a little bit humble on this and recognise the privileges that those of us who are still able to work get. And if it means you can't sit next to your mates while you're having a sandwich, that doesn't seem to be a huge burden to bear.
Just a few hundred metres away, a different group of workers banded together.
The people that stand behind me are working in full PPE, challenged to get a break themselves, challenged to get hydrated, challenged to get time to go to the bathroom.
While tradies rally to get their freedoms back, that's exactly what frontline health workers are pleading against.
It's not about getting on the beers too early, because there won't be beers to be had whilst you're in hospital in an ICU bed.
Weary doctors, nurses, midwives and paramedics say the health system is under immense strain and has warned now is not the time to open up.
Just because you're allowed to have a group of 5 in a park, it's in your own interests not to do that.
It's been a long 18 months. Healthcare workers are tired, parents are tired, community members are tired, business owners are tired. But I think the time for patience is still now.
And the pressure on hospitals is not easing up as case numbers continue to grow in areas of concern. Of today's cases, 276 are in the northern suburbs, 185 in the west, but there are also 38 cases in the southeast.
We are confident that we've got in place the systems to manage that, but the best thing we can all do is to manage that is to keep those infection rates as low as possible.
There are 9 new cases in regional Victoria too, 3 in Ballarat, 1 in the Weimar with links to Ballarat, and there are cases in the Mitchell Shire, the Latrobe Valley and Geelong, all with links to Melbourne. It seems this outbreak isn't ready to pack it in just yet. Tom Maddox, ABC News, Melbourne.